A lot of people think that when guinea pigs get ill to the point where they don't want to eat anymore, it happens so quickly, they get critically ill so fast, it is near impossible to save them. But this doesn't have to be the case. And I know there's no magic pill that can take away every guinea pig ailment out there, and some things are just terminal, whether we know it or not. But there are a number of things that we can do that I truly believe can significantly increase our chances of our guinea pigs getting through a non-terminal illness, living longer as a result, and 100% yes, things that are lifesavers. And these apply to so many common situations where guinea pigs get ill, and when GI stasis sets in, owners just don't know what to do. So let's change that. This is part 1 of 2 videos, which together are an in-depth guide covering how to recognize the signs of an emergency, what to do in terms of visiting the vet, what to expect when you get there, and what kind of treatment plan you should expect. And part 2 will cover everything I recommend doing at home, both before and after the vets, that you can do to help your guinea pig recover fully. Now, I didn't want to do another healthcare video with Pedro being the focus of it, but bless him, as a lot of you will know, he has just been recovering from another episode of bloat and severe tummy trouble. He was at the emergency vets last weekend, and we have been working hard to get him feeling better. And fortunately for us, things are starting to improve now. So thank you so much for all your well wishes. And Pedro, sorry, but you're going to appear in this video a lot. So let's get started, and the first thing we need to be able to do is to spot the signs of illness which could escalate into an emergency. One of the key things I've learned from keeping guinea pigs for many years is that yes, whilst they are good at hiding illnesses, there are different ways we can monitor them both in the long term and the short term. And there are a number of key behaviour changes that we need to look out for that tell us when things are starting to get serious. So you don't need to be a guinea pig expert or to have read all of the medical guides. You just need to know your guinea pig and spend enough time with them to recognize when something's not right. Key signs that mean you need to act now are being less active than normal or being lethargic and not being bothered about you or their cage mates. Showing less or no interest in food, that's a biggie. Having smaller poops or abnormal poops, maybe they're soft and squidgy and not the right shape. And lastly, a measurable loss of weight. We're talking 50 grams in the space of a day or 2. So we should be weighing our guinea pigs on a weekly basis, and if we are getting slightly concerned about them or we see something that's a bit off and not quite normal, then definitely start weighing them every day so you can really keep a track of the changes in their weight, because weight is one of the ways that we can know for sure something is not right when we can't see it for ourselves. And of course there are lots of signs and symptoms of specific health problems such as respiratory infections, bladder problems, problems with the skin, or infections anywhere else in the body. So these could be an underlying health problem, say something that is relatively easy to treat if caught early. But if it's left, or if there's complications and our guinea pigs are suddenly feeling too much pain or too poorly to eat, then that's when things get dangerous. That's when what would be a normal run-of-the-mill illness suddenly becomes something potentially fatal. But with the right emergency care, I have seen guinea pigs come back from the brink. So please don't neglect to get your piggy help, and remember that the sooner you act, the better their chances of survival. So what is taking action? Well, first I'm going to talk about the vets. You should have a good vet in mind, ideally a vet that has experience treating guinea pigs, often known as an exotics vet. And you should be prepared to take them in as an emergency, especially if they're not eating. Unfortunately, exotics vets can be expensive, which is why I highly recommend either insuring your guinea pigs or having a vet fund that you put a little bit of money aside for every month or so, and then you have some money that you can use when your guinea pigs most need it. Also, a note out there for parents: if your child, the one who looks after and knows the guinea pigs best, is telling you that they need to go and see a vet and they need to see a vet vet urgently, then please just take their word for it and book an appointment as soon as you can. With guinea pigs and illnesses, delays often mean worse outcomes and costly complications. So you're at the vets, what should they do? Well, even if it's an emergency appointment, they should do a full examination of your guinea pig. So that's looking at the eyes, the ears, their nose, mouth, look inside to check the teeth. They should feel them all over for any abnormalities. They should listen with a stethoscope to the breathing, to how their chest sounds, their heart rate. They should also listen to how the gut is sounding. And they should ask you lots and lots of questions about why you've brought them in and what's given you cause for concern. Now, if you aren't at an exotics vet's and you have any doubts in the competence of the vet examining your guinea pig, then don't be afraid to ask if one of their colleagues can have a look. A lot of junior, normal, small animal vets can be very inexperienced with guinea pigs. And to be honest, a lot of their senior colleagues can be as well if they simply don't see that many guinea pigs. That's why more and more people who keep guinea pigs are making sure they've got exotics vets on a list that they know they can turn to when their guinea pig needs them. So after doing a full examination, looking at your guinea pigs, it might be that the vets identify something that's wrong and they can start treatment for that straight away. More often than that though, it is not clear what the problem is, and they might opt to do further investigations if you want to, such as x-rays, blood tests, but only if the guinea pig is well enough for that, and maybe other scans if they have that equipment available. Next up, they should tell you what their approach is going to be, and up high on their list should be rehydration. Dehydration in guinea pigs and other animals has a huge effect on how well they feel within themselves, and importantly, how well they take up food and medicines. As well as that, we've often got pain relief. So obviously, if your guinea pig is in lots of pain and it's that, and that is the main reason why they aren't eating, then offering them pain relief can make a world of difference. And in part 2 of this series, I will cover these medications in a bit more detail, give you some examples of the types that might actually be prescribed, as well as how to administer them. Next up, they might also consider some kind of gut stimulants, or what the vets also call prokinetics. Now, these are basically medicines that help the gut get back on track, help it get moving again, which is so important if GI stasis has set in. And lastly, if they suspect there's some kind of bacterial infection somewhere, which could be the root cause of the problems, then you may be prescribed some form of antibiotics. More rarely, there might be situations where emergency surgery is needed, in which case, if you are lucky enough to be at a vet's where they have the right people to carry that out, then that could be the only option for saving your guinea pig. But as I said, often we don't know what's wrong, and the vets are just using everything that they can to treat that emergency situation. And that is exactly what we had with Pedro last week. So he wasn't eating, his poops were way off how they should be. He was brought in as an emergency. The vets did a full examination. We actually did get another vet in the end who kind of took over from the first one. So I'll go back to that point again. Don't be afraid to ask for one of their colleagues to look. And with Pedro, it still wasn't clear what was causing things. So we actually had some x-rays done, and they sent them off to the vet WhatsApp group to see if any of the exotics vets who weren't there in person at the practice, to see whether they could comment on the x-rays and advise what we should do about them. And interestingly, the exotics vets advised prokinetics and gut stimulants because of the amount of gas that was showing up in Pedro's stomach. I had the option of either taking him home and nursing him myself, or leaving him there to be hospitalized. And it's a really difficult decision. The vets wanted to take him off me, and I most certainly was not going to let them take my baby. But that's really because I knew that I could do everything for him at home, and he was going to receive the same, if not better care at home with me than he was going to at the vets. However, if you are not experienced with syringe feeding, you're not sure whether you can get the medicines into them, or perhaps you're just not going to be around enough to feed them every 4 to 8 hours, then it might be worth leaving them at the vets, as long as you have good faith in your vets. And if you leave them to be hospitalized, they will get fluids straight under the skin. They will get the medicines injected or via a drip if they're able to set up one, and they can really do a lot of positive actions that can help stop that emergency situation from becoming any worse. So it entirely depends on your personal situation and what you feel is best for your piggy at that time. And there is of course a cost with hospitalization, and even when you bring them home after that initial period after leaving them at the vets, there might still be a lot of recovery and a lot of helping them get better. So that's where part 2 comes in, where we're going to look at everything related to caring for them at home. And it's also important in terms of being prepared and having all of these things in your first aid kit. So not only can you do these things after you've been to the vets, but you can start them straight away from home when you realise there's a problem going on. And I will link part 2 here when it's available, but in the meantime, I hope you found this video useful, and now you know those important signs to look out for in your guinea pigs and what you should expect from the vets. As always guys, thank you so much for watching, and we'll see you in the next video. Bye bye!